welcome back to my channel. And this is a continuation of a series called 5000 SPs, and this chapter belongs to physiology. Let's start. Angiogenesis and collagen deposition, they are features of which stage of wound healing? So first you have to be know about the wound healing. In the wound healing, there is the collagen deposition, and then there is angiogenesis, and they both occur during the process of the proliferation or the granulation stage. And this stage, they involves a fibroblast which lays down the new extracellular matrix, and then reptilization also occurs. So what is the let's see the question again. Angiogenesis and collagen deposition, they are the feature of which stage of the wound healing? So the answer is the question option B, which is the proliferation, because the collagen deposition and angiogenesis, they are the features of the proliferation, which is also called as granulation. And this stage, it also involves the fibroblast laying down and a new extracellular matrix. Now let's see question number 2. The amniotic fluid volume, it peaks at around 900 ml. At what gestation does the amniotic fluid reaches its maximum volume? The answer is 35 weeks. The amniotic fluid volume, it increases up to 35 weeks of the gestation, and then it decreases till down. Question 3. According to UK Food Standard Agency, which of the following recommended daily intake is 3 times higher in the pregnancy than the pregnancy state? We have covered this in our previous lectures, that it is the folic acid. The daily recommended doses of the folate, they increases 3-fold for the first trimester of the pregnancy. Vitamin C and iron daily dose intakes are increased by less than double. Next, a patient, how long it will be before her cesarean section wound is at full strength? What is the typical time taken for the wound closed by the primary intention to reach full tensile strength? The answer is 12 weeks. And remodeling is usually underway by week 3, and maximum tensile wound strength is typically achieved at the 12 weeks. Question 5. Which of the following statement regarding the thyroid function test in the pregnancy is true? Let's see the option. TSH levels increases in pregnancy. No, false. The TSH levels remain constant throughout the trimester. That is again false. Total T3 levels, they drop in pregnancy, they raise in pregnancy. Free T3 levels, they usually drops in the pregnancy. Yes, that is true. And thyroid hormone binding globulin levels, they drop during pregnancy. No, that is false, because they increases. Because the maternal free T4 and free T3, they are the total hormone concentration, they must be measured in the pregnancy. This is because total 3, 4 and T3, they increases in pregnancy. Normally they increases in pregnancy, and due to increased serum concentration of the thyroid hormone binding proteins. It is only the free T3 and T4 fraction which is not bound to the protein, that can injure the cells and modify the metabolism. Trimester specific reference ranges for the free T3 and free T4 need to be used. And the TSH levels, they are typically lower in the pregnancy, and that is a different reference from the each trimester. Question number 6. Regarding the heart rate in the pregnancy, which of the following statement is true? Heart rate decreases by 15% beats per minute. No, because it increases. The heart rate remain constant. No, that increases. And the heart rate increases by 15 beats per minute. Yes, that is true. Heart rate increases by 25 beats per minute. No, that is false, because it increases 10 to 15 beats per minute, and none of above is not the option. Because during the pregnancy, the heart rate, it increases by approximately 15 beats per minute above the baseline. Question number 7. What percentage of the hemoglobin is HbF in the newborn? Yes, it is 50 to 90%, because the 90%, up to the 90% of the blood in the fetus is HbF. They are the different because there are some different sources. They are often 90% it quoted. However, the electrophoresis, they shows that it is 70% of the hemoglobin is HbF at the birth. Now the next is cardiac output is calculated by the, we all know that cardiac output is calculated by the stroke volume into the heart rate, and stroke volume is equal to the end diastolic volume minus end systolic volume. What is the average lifespan of the basophil or the white blood cell? The average lifespan of a basophil is 3 to 4 days, and there are the different cells like RBC. It has got 120 days of the lifespan. The platelets, it is the most common question which is asked again and again in the exams. It is about 5 to 9 days. The white blood cells, all the white blood cells, they are from 2 to 5 days, but particularly the neutrophils, they remains in the blood up to the 5 days, and basophils, they are 2 to 3 days, or here, as the option is not mentioned to do 3 days, so we are going to choose the minimum of the options, that is 3 to 4 days. And eosinophils against 2 to 5 days, and monocytes 1 to 5 days, and lymphocytes are variable because the turnover is high. So oxytocin, they causes increased myometrial contractions by which of the following messenger pathways? And we all know that oxytocin is an enzyme which activates the messenger pathway by the adenosine phospholipase C, which is AMPC, and which instead produces IP3, and which triggers the intracellular calcium and release. So option A is the correct. Rest of the, because rest of the options are wrong. And because oxytocin, it activates the phospholipase C to produce inositol 145 triphosphatase, and which releases the calcium from the intracellular stores, and they are thought to be the other mechanism by which the myometrium is stimulated by the oxytocin, and including the increased sensitization of the myometrium and increased calcium entering to the cell. CMP and protein kinases A inhibits the myometrial activity. Next question, where in the kidney is the majority of the bicarbs reabsorbed? We all know that it is the proximal convoluted tubule PCT, and because the maximum majority of the reabsorption of any ionate occurs in the PCT, and in the proximal convoluted tube, the glucose, amino acids, carboxylate, bicarbonates, phosphate, potassium, sodium, urea, calcium, magnesium, and water variable absorption, they occurs to the nephron. Okay, and next question, what is the primary form of the hemoglobin in 6-week old fetus? It is the hemoglobin Gover 1, because for the first 10 to 12 weeks of the birth, the fetal development embryonic hemoglobin HbE is the primary form of hemoglobin. It is produced by the yolk sac from the first week of the pregnancy until the birth. It is a tetramer consisting of the Gover 1, 2, Portland 1, and Portland 2. Of all these 4 subtypes of the hemoglobin E, or the embryonic hemoglobin, and the subtype Gover 1 is the primary form, and after 10 to 12 weeks, the fetal hemoglobin, they becomes the primary form and comprises the 50 to 90% of the hemoglobin at birth. It is almost completely replaced by the adult hemoglobin by the 6 months of the age. Next question, the placental productions of the HPL and HCG, estrogen, progesterone, are examples of which type of the mechanism? The human placental lactogen, HCG, human chorionic gonadotropin, estrogen, and progesterone, they all are the endocrine hormones produced from the endocrine gland, because hormones that are secreted into the circulation at one side but have effect on the distal target, they are known as the endocrine, and these are the hormones which belong to endocrine category. And autocrine and intracrine messengers, they act within the same cells, and exocrine glands, they secrete their product into the duct, and apocrine is the histological term which is used to describe some time of the exocrine glands. Next question, regarding the closure of the ductus arteriosus after the birth, which of the most accurately describe the mechanism of the leading to closure of the ductus arteriosus? Yes, what happened that after the birth there is an increased partial pressure of oxygen, and this lead to the increased bradykinins, and there is decrease prostaglandin E2, when there is a decrease in the prostaglandin E2, um, um, there will be the closure of the ductus arteriosus. So option C is the correct option. Option C is the correct option. What happened that upon the delivery of the newborn, when he takes the first breath, the lungs they get inflated. Okay, these lungs they get inflated. Oxygen comes in through these lungs. When oxygen comes in, the pressure of the oxygen it increases, and oxygen is known to cause the constrictions of the ductus arteriosus in vitro and in vivo. In addition, there is a decrease in the vascular resistance. There is decrease in the vascular resistance, and means the pressure within the lumen of the ductus arteriosus it drops, which also lead to its closure. In addition, there is when there is inflation of the lung it produces the bradykinins. Hence, the bradykinins also increases, which also stimulates the smooth muscles, and these smooth muscles they are going to constrict, and there is a closure of the ductus arteriosus. But the most important factor is thought to be the drop of the prostaglandin E2 level, and as this prostaglandin E2 they maintains the patency of the ductus in the unborn child, but after the birth is metabolized in the lungs, and its levels they falls rapidly within 3 hours of the birth, and this lead to the closure of the ductus arteriosus. Next question: what is the typical volume increases from the non-pregnant to the pregnant uterus? This option is correct because it is from 10 ml to 5000 ml, and when the uterus is non-pregnant, it's a weigh about the 40 to 50 gram, and its volume is about 10 ml. And when at term the uterus it weighs about the 1.1 to 1.2 kg, and the volume is about 5000 ml. So the option A 10 ml to 5000 ml is correct. Next question: what is which of the following is the potent stimulator of the aldosterone? The potent stimulator of the aldosterone is the hyperkalemia. Because the hyperkalemia it is basically the most potent stimulator of the aldosterone, because the juxtaglomerular cells in the kidneys, the juxtaglomerular cells, they also secretes renin in it. They secrete serotonin in it, that will ultimately stimulate the aldosterone in response to the hyponatremia, such as that there is decreased level of the sodiums, and hypotension when there is a volume decreases. When there is a decreased sodium, there is the increased potassium, so the hyperkalemia it leads to the stimulation of the aldosterone. Next question: following parturition, the uterine contractions they causes the after pain, they may typically continue for how long? They are going to the pains they continues for 2 to 3 days, and because and never more than that, because the oxytocin it releases because of the stimulations of the breast, and breastfeeding it may intensify the pain, and it causes a uterine contraction, and here there is no option of 2 to 3 days, so the option E will be correct, which is none of the above, because 2 to 3 days. Next question: at what gestational age does the luteoplacental they shift occurs? Yes, it occurs at the 6 to 8 weeks, because the luteoplacental shift it refers to the point in the time where the placenta it take in charge from the corpus luteum for the productions of the estrogen and progesterone, which are required for the to maintain the pregnancy, and this period occurs around the 6 to 8 weeks. Next question: and during wound healing the clotting cascade is activated. The clotting cascade is activated, which of the following activates the intrinsic pathway? Yes, it is the damaged endothelium which activates the intrinsic pathway, and the clotting cascade they can be activated either by the damaged endothelium, which is the intrinsic pathway, or the tissue factor, which is the extrinsic pathway. We're going to do this in detail in our coming lectures or coming slides. In next question: in the third trimester anemia is defined by the anemia is defined by when the hemoglobin level is less than 105 gram per liter, and in the first trimester it is when it is less than 110 gram per liter. In the second trimester when it is less than 105, and in the third trimester and the post in the third trimester it is again 105, and in the postpartum time when it is less than 100 gram per liter, it is defined as the anemia. Which what is the typical weight of a non-pregnant premenopausal uterus? Yes, we have even discussed this previously, that it is the 30 to 40 gram, and 40 to 50 gram. And now let's move to the next question. You review a 58-year-old patient in the clinic. She asked that the results of her recent DEXA scans, and they are as follows: that the T score is minus 1.4. You note she has a history of the olecranon fracture, which is 4 years ago. What is her classification according to the WHO criteria? And it is osteopenia, because her T score is less than 1, minus 1. So this belongs to the osteopenic category of the WHO. We are also going to discuss it again. Which of the following is the primary site of the prostaglandin E2 production? The primary site of the prostaglandin E2 production is the placenta, and they are produced in almost all the nucleated cells. The placenta and ductus arteriosus is particularly have the high quantities of the COX enzyme in forms, and which are required for the synthesis of the PGE2. Next question: which of the following lung function the values unchanged in the pregnancy? We discussed it yesterday, that is the FEV1 value. And FEV, just remember, FEV1, functional vital capacity, they remains unchanged, and even their ratio, if they don't change, their ratio will remain again the same throughout the pregnancy. During pregnancy, which hormone they inhibits the lactogenesis? It is the estrogen and progesterone combined, because the prolactin levels they rises steadily during the pregnancy, and during which time it promotes memory growth along with the other hormones. Estrogen and progesterone they inhibits the lactogenesis, and it is only with the loss of these placental steroid hormones and the term that prolactin exhibit the lactogenic effect. In the next question: in the earliest phase of the wound healing, platelets are held together by the fibrin. The first stage of the wound healing is the hemostasis. The most important is it is to stop the flow of the blood. Even in the insides wounds, a small hematoma it forms. Here the clotting cascade is activated by the tissue factors and endothelial cells, results in the activation of the platelets, and this results in the platelet aggregation and the laying down of the fibrin mesh, and that is cross linked and hold the platelet in the place. Next question: regarding the cardiac examination during the pregnancy, which of the following findings they should be considered the pathological? Yes, it is the diastolic murmur, because the benign conditions like T wave flattening in the lead 3 and on ECG, systolic murmur, left axis deviation, and third heart sounds, they can be present during the pregnancy. Next question: during pregnancy, the GFR changes as the follows. GFR, the glomerular filtration rate, it increases by 40%. Option E is correct, and it is basically started at the end of the first trimester. Now next question: where is the kidney? The majority of the bicarbs reabsorb. We discussed it previously, the proximal distillate convoluted tubule. And next question: during the wound healing, collagen alignment along the tension the lines in the part of which phase? It is the proliferation phase. We again discussed that the collagen alignment along with the tension the lines in during the proliferation phase. And because the realignment of the collagen is a part of the remodeling phase, and remodeling is usually underway by 3 weeks, and maximum tensile bone strength is occurs by the week 12, by week 12. Which of the following tests is used to detect the antibodies or the complement bound to the red blood cells antigen in the vivo? It is the direct comb cells, and because it is the direct comb cells where we use this test to detect the antibodies or the complement bound to the red blood cells antigens in vivo. Next question: which of the following hormones inhibit the galactopoiesis and the lactogenesis postpartum? It is the dopamine, and galactopoiesis and the lactogenesis, they are stimulated by the prolactin, and dopamine released under the hypothalamic control inhibits the prolactin production. Next question: the several mechanisms they have been proposed to which cells they close to ductus arteriosus. at the parturition, which of the following is the most important or in maintaining the patency of the ductus arteriosus during the pregnancy? It is the prostaglandin E2. We discussed it previously that the prostaglandin E1 and E2 help they help maintain the patency of the ductus arteriosus during pregnancy. PGE2 is by far the most potent and important. It is produced in the large quantities by the placenta and the ductus arteriosus itself. Next question, you review a patient who is 34-week pregnant and she complains of gradually worsening itching over the past 6 weeks, and particularly to the hands and the feet, which is worse at night. You order some bloods. Which of the following would you normally expect increase in the third trimester? Is again the ALP, because ALP they rises up to 3 times the normal non-pregnant values in the third trimester, and rest usually decreases or remains normal. Lactogenesis at term is stimulated by which hormone? It is definitely stimulated by the prolactin, and because oxytocin it allows the milk ejection reflex, which is called as a letdown in response to the suckling, and the galactopoiesis, it is maintained by the actions of the prolactin, and the alveolar gland proliferation and the differentiation they occurs under the actions of the estrogens, progesterones, human placental lactogen, and prolactin, and it is a prolactin which stimulates the lactogenesis when not inhibited. Next question, regarding the use of the erythropoietin, recombinant human erythropoietin, also known as RHUEPO, in the pregnancy. Which of the following statement is correct? The here let's see the green top guidelines. What does they say? That the recombinant human erythropoietin, it is mostly used in the anemia. It is used in the anemia and end stage kidney disease, and it has been used both antenatally and postpartum in the woman without the end stage renal disease, without any adverse maternal, fetal, or the neonatal effects. And in the clinical practice for the known and stage renal anemia is still to be estimated and should only be used in context to a controlled clinical trial. So let's move to the option. Erythropoietin has been shown to be have adverse maternal effects when used antenatally. No, that is incorrect, because it's shown positive effects. Erythropoietin have been shown to have the adverse fetal effect. No, that is again wrong. And EU has shown to have been adverse neonatal effects. No, again wrong, because anemia causes more danger to the baby. And next is the only recombinant for non-stray and renal. No, that is used in the pregnancy. So option E will be the correct, because none of the options are correct. Next question, during the wound healing the clotting cascade is activated. Which of the following activates the extrinsic pathway? We have discussed it previously that it is the tissue factor which activates the extrinsic pathway. Next, during the wound healing, the clotting cascade is activated. Which of the following activates the extrinsic pathway? Yes, this is again what happened that it is the third stage. No, I think that this question is wrong, because they are the different options. But this question belongs to the previous question when we have answered that it is a tissue factor. And let's leave this question. Let's see the next question. Which of the following is primary stimulator of the uterine involution following the child? Which is oxytocin, because we all know that oxytocin, it is a primary stimulus for the uterine involution following the childbirth. Next question, 50 years old female, they attend for the results of her bone test, and her T score is minus 2.2. She tells she has previously fractures in her metasternal and patella following a fall from a bike. You diagnosis as, let's see what happened, that there is a T score. If we consider this as a T score, the 0 0 0, this is +1 +2, this is -1, and this is -2, and this is -3, or -2.5, and in this case -3. Okay, what happens at -1 to +1? It is the normal. It is a normal. What happened at -1 to -2.5? It is the osteopenia, and less than -2.5, it is the osteoporosis. So this at her T score is -2.2. So this patient belongs to osteopenic group of the WHO criteria. Now pregnant patient, they are at the high risk of the thromboembolism due to the hypercoagulable state. Which of the following clotting factors it reduces during the pregnancy? Yes, the among the option it is factor 11 which reduces during the pregnancy. And Her hypercoagulable state is thought to result primarily from the increased levels of the factor 7 and fibrinogen, and other clotting factors which also raises are the 8, 9, 10 and 13, and physiological anticoagulants such as protein S they also reduces. Clotting factors 11 and 13 reduces during the pregnancy. 8, 9, 10 and 12 they raises. Next question, when using the MDRD formula to calculate the GFR, which of the following is not a factor to that? So one should know what is the MDR formula, and we are going to discuss in detail in the next coming slides. But here among this, creatinine is just again used, sex also used, age and ethnic background is used, but the urea is not used in the formula. Next question, where in the kidney is the majority of the sodium and the glucose reabsorbed? We have discussed this previously that the majority of the ions they are absorbed in the proximal tubule and convoluted tubule. And next question, at which gestation does the fetus they started the swallowing? The swallowing reflexes started at the 12th week of the gestation, and they started swallowing the amniotic fluid. And amniotic fluid, it is a combination of the fetal urine and other secretions from the GI tract. And what is the fetal urine? The first fetal urine, it is produced at the 8 to 11 weeks. By term, the fetus they produces among 800 ml of the urine per day. Fetal swallowing it start at the 12 weeks and the 250 ml swallowed per day, and fetal lung secretions they are the 300 ml per day by the second trimester. These are the important hygiene points. And next question is the dilations of the uterine cervix at the parturition is primarily achieved by the achieved by the degradation of type 1 collagen, which are the intestinal which is done by the intestinal collagenase. What happens, the cervix wrapping they refers to the softening of the cervix prior to the labor. It is complete complex process that involves the process like there is an increased activity of the metalloproteinases 2 and 9 that degrades extracellular matrix proteins, and the cervical collagenases and the elastases they also increases, and degradations of the collagen they increases, leading to the decreased collagen content in the cervix, and there is increased estrogen lead to the increased collagenases activity, and increase COX-2 causing the increased prostaglandin, and prostaglandin E2 leads to the increase in the collagen degradation, increase in the hyaluronic acid, increase in the chemotaxis for the leukocytes, which causes increased collagen degradation, and increase in the stimulations of the interleukin IL-8 release, and the prostaglandin F2 alpha is also involved in the process, while the ability to stimulate and increase in the glycosamine glycans. Next question, what is the typical oxygen consumptions in the 75 kg non-pregnant woman? It is about 250 ml per minute, and in pregnancy it increases by 20% and becomes a 300 ml per minute. Next question, regarding the blood volume in the pregnancy, which of the following statement is true? We all know that the blood volume is slowly increases by 40 to 50% during the pregnancy, and this increase is due to the increased aldosterone, and this rise in the volume they mostly occurs during the first trimester. Now what is the primary form of the hemoglobin at the 18-week old fetus? Again, it is the at the 18 week it is the HbF, because the cutoff is the 10 to 12 weeks, 10 to 12 weeks, and prior to the 12 weeks it is the embryonic hemoglobin, which is again the GOVR1, which is primary, and after 12 weeks it is the hemoglobin F, which is by birth at about the 70 to 90%. Next question, what is the typical peak change in the oxygen consumption in a pregnant person? It is about the 20%, and pre-pregnant it is 250 ml per minute, and in the pregnancy it is increased to 300 ml per minute. Next question, which statement is the primary mechanism for the shunting blood away from the fetal pulmonary circulation? It is a foramen ovale, and blood enters in the right atrium of the heart, This is the heart. These are the four chambers. Blood enter in the right atrium, and here there is a foramen ovale. What happened that the when the blood enters the right atrium of the fetal heart, and the most passes through the foramen ovale from here to here and into the left atrium. This is the left atrium, and from there it is pumped through the aorta, and here in the right ventricle and again to the aorta, and thus bypassing the fetal pulmonary circulation. Next question: which of the following changes by biliary physiology occurs during the pregnancy? What happens here is the increased lithogenic index, and hence this lead to the increased chances of the having the stones during the pregnancy. Which of the following is responsible for the aquaporin 2 protein channels opening in the collecting duct? It is antidiuretic hormone, which is also called as vasopressin, because the vasopressin, it is also known as AVP or antidiuretic hormone. It is released from the posterior pituitary gland and promotes the water retention by the following method, which insertions. Number one is the insertion of the water channel protein called the aquaporins into the collecting duct and DCT, and there is the increased activity of the urea transporter proteins in the collecting duct, promoting the urea flow out of the collecting duct and the water by the increased osmotic gradients, and when there is the increased sodium reabsorption occurring across the ascending loop of the Henle. The receptors in the hypothalamus, they detect increase in the serum osmolarity and stimulates the posterior pituitary to secrete the ADH, and this is the main stimulus. Vasopressin is also vasoconstrictor and is stimulated when decreased in the plasma volume, are detected by the baroreceptors in the atria and the carotid sinus. Next question: and aldosterone, it promotes the water retention by which of the following mechanism? We know that it is the upregulation of the sodium potassium pump in the distal tubule and the collecting collecting duct. Because aldosterone, they stimulates the sodium reabsorption in the kidney by the mechanism, like when there is a upregulation of the aquaporins and the urea transport proteins, are mechanism of the water retention stimulated by the ADH or vasopressin. Next question: during the inflammatory phase of the wound healing, what is the predominant cell found in the wound during the first 24 hours? Yes, it is the polymorphonuclear neutrophils. Because during the inflammation phase, what happens during the inflammation phase, where which overlaps the hemostasis phase, fibronectin and the growth factors, they attract the polymorphonuclei to the wound sites. They have predominated cell types of the in the first 2 days, and these cells, they phagocytize debris and kill the bacteria by the free radicals, also known as respiratory burst, and they also break down the damaged tissues. Next question: what is now the next question: what is the average lifespan of the red blood cells? We know that it is 120 days. Next question: a patient, they attends a maternity unit as her waters have broken, but she has not had the contraction. She is 39 plus 6 weeks, and per speculum examination confirms the pre-labor rupture of the membrane. What is the likely of the spontaneous labor starting after the within the 24 hours? It is the 60%. As she is in the term and there is a pre-labor rupture of the membrane, the risk of the serious neonatal infection is about 1%, and 60% of the patient with the form, they go into the labor in 24 hours. Inductions, they are appropriate if more than 24 hours post rupture and the patients, they had go into the labor. So where is the getting the majority of the potassium and the phosphate reabsorbed? Yes, that's again it is the proximal convoluted tubule. So the next question: what is the average lifespan of the platelets? It is again the 5 to 9 days, and we all know that. And next question: which of the following increases during the pregnancy? We know that it is the tidal polymer increases during the pregnancy. Next question: during the inflammatory phase of the wound healing, which is the predominant cell type found in the wound healing at the day 3 to 4? It is the macrophages, because initially in the first 2 days, these are the morphonuclear neutrophils, and sorry, not mono, but the polymorphonuclear in the first 2 days, and then in the 3 to 4 days, the macrophages, which are the predominant. Now, what percentage of the hemoglobin F by the 6 months of the age? It is again less than 2%, because by the 6 months of the age, the most fetal hemoglobin they has been replaced by the adult hemoglobin, and electrophoresis suggests that it is about less than 2% of the HbF. Now, 99% of the body calcium is in which form? The 99% is present in the calcium phosphate. In the calcium phosphate, the 9% of the body calcium is stored in the skeleton and as a calcium phosphate salts, and then there are the several calcium phosphate salts. The most abundant is upon hydroxyl hydroxyl peptide. Next question, minute ventilation, the pregnancy increases due which of the following? Because there increases because of the increased circulating progesterone, and this is thought to be the results of the increased circulating progesterone, because the progesterone is known to the directly stimulates the ventilation by sensitizing the CNS respiratory centers to the carbon dioxide. And increased minute ventilation, they blow off CO2, and as a result of the PO2 it is reduced. The pH hemostasis is maintained by the increased renal excretions of the cups. Next question, it is upregulations of the urea movement through the urea transport protein is the collecting duct is an effect of the vasopressin, because the vasopressin it causes the uptake of the urea transport proteins in the collecting duct. Which next question, which what is the maximum normal menstrual blood loss? It is about the 80 to 85 ml. And next question, which of the following would you expect to be raised in the pregnancy? Yes, it is the ALP. We have discussed it previously that it is ALP which can be raised, and during the pregnancy the gamma GT tells it can also be raised during the pregnancy, and things which decreases includes the AST, ALT, and albumin T is usually decreased during the pregnancy. Next question, in reducing the risk of the blood transfusions in the pregnancy and the labor, which of the following strategies is recommended? Okay, the RCG or the green top guidelines, according to them, the hemoglobin of less than 105 gram per liter, they should prompt the hematinics and exclusions of the hemoglobinopathies. If the hemoglobin is less than 10.5 gram per deciliter in the antenatal period, consider the hemolytic deficiency. Once the hemoglobinopathies have been excluded, oral iron in the first line is the first line treatment of the iron deficiency. The cell salvage is recommended for the women in whom an intraoperative blood loss of about more than 1500 ml is anticipated. Anemia is not due to the hematinic deficiency, will not respond to any form of the iron. This should be managed with the transfusion. Recombined human erythropoietin is used in the end stage renal failure. Its role in other situation is still to be estimated and should only be used as a part of the control trial. In the pregnancy, the pre-autologous deposits is not recommended according to the RCG guidelines. In theory, the patients they can have their own blood taken and deposited for up to the 5 weeks, but concerns they have been raised over the placental insufficiency and inadequate corrections of the blood loss caused by the procedure. Next question, you review a patient about the 34 weeks of the gestation. She complains of the gradual worsening of the itching in the past 6 weeks, and particularly to the hands and feet, which is worsened. At what is the likely cause? And the most common cause of the itching in the pregnancy is obstetric cholestasis, and it usually occurs in the third trimester and get worse towards the term. Itching of the hands and feet is common, and the jaundice they may also be present. Next question, which GFR calculator is recommended by the NICE? It is the MDRD formula. It is recommended by the NICE, because it should be noted that the GFR estimations they are not advised in the pregnancy. In this case, a 24-hour creatinine measurement is suggested as a gold standard testing in the purpose of the renal function assessments. Next question, what is the average volume of the blood loss during the menstrual cycle? It is again 80 to 85%. We just discussed it. Sorry, here they ask about the average blood loss. The 80 to 85 ml, it is the maximum blood loss, but 30 to 40% is the average blood loss. Next question: at which stage of the fetal development does the fetal hemoglobin they replace the embryonic hemoglobin? It is 10 to 12 weeks, which is the cutoff value. Because the embryonic hemoglobin, it has the four subtypes: the Gobble 1, Gobble 2, Portland 1, and Portland 2. Among these four, the Gobble 1 is the most common. And fetal hemoglobin, it is HbF, and it is a primary form of the hemoglobin from the above the 12 weeks of the fetal development. At birth, it comprises 50 to 90% of the hemoglobin, and by the 6 months of the age, adult hemoglobin is the primary form. And next question: at which gestation does the fetus they start producing the urine? The urine is produced by the fetus starts at the 8 to 11 weeks, and it is usually associated with amniotic fluid. And the first fetal urine produces at the 8 to 12 weeks, and by the time the fetus produces approximately 800 ml of the urine. Fetal swallowings, they starts at 12 week of the gestation, and 250 ml swallowed per day, and fetal lung secretions are about 300 ml per day, and by the second trimester. Next, the maternal blood flow through the uterine artery at the term is approximately 750 ml per minute. The uterine artery flow increases from the approximately 45 ml per minute to a non-pregnant state to around the 750 ml per minute at term. At term, this can be approximately 12% of the maternal cardiac output. Next question: the following the partition, how long does the involution of the uterus take place? It takes place about the percutaneous time, which is about 4 to 6 weeks. And next question: which of the following is the main reason for the active management of the third stage of the labor? It is done to prevent the postpartum hemorrhage. And word WHO and FIGO and the international confederations of midwife, they recommend active management of the stage of the labor in all the vaginal deliveries to help prevent the postpartum hemorrhage. Next question: which of the following is the thrombotic agent? The prothrombotic agent is the thromboplastin, because and the protein S, protein C, antithrombin 3, and the plasmin. They are the antithrombotic. Next question: which of the following statement is true regarding the renal blood flow in the pregnancy? And it is that the renal blood flow increases by approximately 50%. And because of the increase the cardiac output and the blood flow, renal blood flow and the GFR, they increase by approximately 50 to 60%. Next question: which of the following statement regarding the placenta and the fetal-maternal circulations, they are the false? And let's discuss one by one. Deoxygenated fetal blood there arrives at the plasma via the two umbilical arteries. Option number: cardiac output decreases by approximately 10 to 15%. That is wrong. Cardiac output remain constant. That is again wrong. Cardiac output increases by approximately 10 to no, it increases by 40 to 50%. So option D is correct. Now next question: what is the typical weight of the term uterus? It is about 1200 gram. We discussed it previously that it is about 1.1 to 1.2 kg. Next question: breast milk is produced by the secretions of the epithelial cells of the acinar, and which of the following is an accurate estimation of mature breast milk composition? That breast milk, it contains fat about 4%, protein about 1%, and sugar about 7%. So the option A will be the correct option. Sugar is only 7%, protein is 1%, and fat is 4%. And although the colostrum, they may have the high protein compositions and low sugar concentrations, the mature breast milk, they contains approximately 1% protein, 4% fat, and 7% sugar, 1%. Next question: which of the following prolong the prothrombin time? It is the factor 5 deficiency which prolongs the prothrombin time. Okay, the last question of the series is that the question number 83. The primary stimulus for the ADH, or the antidiuretic hormone, also known as the vasopressin, is released is the high serum osmolarity. Option B. It is a potent stimulator of the ADH. Increasing the serum concentration such that high osmolarity is the primary stimulus, and decreased blood volume and reduce ECF. They does also stimulate the ADH, but the hypothalamus is less sensitive to this. So hope you like the video. Kindly share and subscribe. Thank you. Take care. Bye.